Welcome, both of you.
Ah,
I hope you're doing very well this evening.
thank you, Carl.
Thank you so much for having me, Carl. This is great.
Yeah. So Dr. Wildgoose is a specialist in early age onset colorectal cancer, and Melissa Groff is a early age onset colorectal cancer survivor. And for all of you listening, you will know this. You signed up, you joined, you came to see our talk, which is on prevention and awareness, both for early age onset colorectal cancer and more broadly. So something that I like to do is maybe offer each of you a chance to introduce yourself to our wonderful guests. Melissa, would you like to share a little bit about your story and why we're so happy to have you?
Sure. Thank you again for having me. So, I am, as you can tell, a young mom. I have three beautiful children and a wonderful husband. I was actually diagnosed with stage 3 rectal cancer just days after my third child's first birthday. I had experienced some rectal bleeding, some change in bowel movements, and to be honest, I thought it was just a hemorrhoid. My body was changing, especially post pregnancy and having three children. So I wasn't too concerned, but I did raise it with my family doctor, and she said, let's send you for a colonoscopy. And I was diagnosed in October of 2023, and I've been on this journey since then. And I'm so thankful and happy that I came across Colorectal Cancer Canada because it's been a great support system for someone like me.
Well, that's wonderful to hear. And we'll talk more later about sort of the kind of support that you were looking for and that CCC was able to provide to you. Um, but I am again very glad that we have been helpful to you, and I'm very glad that you are here with us today. Dr. Wildgoose, would you like to tell the people about your work?
Sure. Thank you so much for having me. It's an honor and a pleasure. I'm a family doctor by training, but I am a specialist in specifically in oncology. And in 2019, I started the Young Adult Colorectal Cancer Program at Sunnybrook Hospital. And really, this was for two reasons. Is number one, the increasing incidence that we've been seeing over the past long while, actually, but in our clinic for a little while prior to 2019, and also because of the unique needs of younger patients. And so it's really been a great work in progress. And I work as part of a big multidisciplinary team, but essentially we address things like mood, sleep, diet, exercise, fertility, menopause. A huge one is psychosocial and psychological side effects from just the diagnosis, but also treatment, survivorship. The list goes on and on. And these are unique needs to patients, in their 20s, 30s, and 40s, compared to adults that, may expect a diagnosis of cancer if you're in your 70s and 80s and it's later on in life. So I'm very grateful to be here because I also do a lot of advocacy work when I'm not working as a clinician. So I'm looking forward to the talk today.
Yeah. So the way that I have been thinking about structuring this talk is kind of following, we're talking about prevention, we're talking about awareness, but also I think it's important to understand prevention and awareness because of what they mean for what comes after. Colorectal cancer is a highly treatable illness when it's detected early, and that's why we want to, March Awareness Month, talk about awareness, talk about education around these things. So maybe we could begin, Melissa, if you wanted to share a little bit about your experience of getting a diagnosis.
Sure. So, as I mentioned, I went for my very first colonoscopy, and in the grand scheme of it, talking about advocacy, I've been telling everybody it's the easiest thing you can probably do when you're going through some health issues. And it was hearing that I had rectal cancer was the absolute last thing I ever expected to find out from that colonoscopy. Um, but as much of a shocker as it came to me, I said, you know what, I've got to figure out how I'm going to tackle this. And I've really taken that to heart. I've called this the biggest project of my life. It started from the moment I spoke to the surgeon's office and started asking the questions, when's my first scan going to be? So after an MRI and a CT, we decided that it was best for me to proceed with surgery, have the tumor removed from my rectum. There was some surrounding lymph nodes that they removed as well, and some of those were cancerous as well. I also had a distant lymph node in my pelvic area. So, it's interesting because as you learn about receiving a diagnosis and learning how to even read a scan, you do get something that I've learned called scan anxiety, and that waiting game and just trying to understand what to do with all of this information. It's overwhelming. And I knew that based on my personality, I was going to ask questions and I was looking for that support. And when I met with my oncologist for the first time, it was another whole new experience for me. And I've learned so much from meeting with different doctors and learning about different treatments, and even being a part of the Colorectal Cancer Canada group and being in an early age onset webinar. That's a great way for young people like myself to connect with others that are experiencing something similar. And another thing I also had to keep in mind was how unique my journey is to me. And everybody's journey is going to be unique to them. So as much as we like to compare ourselves, we're also very different.
Mm-hmm. I think those two things about like being connected to other people, and then also about like the specificity are really important. Um, for I think when we get more into the details, it'll be clear why I'm kind of flagging those now. Um, but in our kind of pre-show conversations, you had talked about how you had kind of a journey from like, hey, something strange is happening in my body, to getting the information that you needed to be able to know what that is. Would you want to share a little bit about those steps?
Sure. So once I found out about the tumor in my rectum, I started making some phone calls to people that I knew that were affected by cancer, whether they had cancer themselves or they knew somebody that did. I started asking what type of treatment options did they go for? What does your diet look like? How is your lifestyle? Just some of these pointers that I felt would help assist me in understanding this journey. Admittedly, like I left my first appointment with my oncologist with a bag of papers, and I thought, what am I going to do with all of this? It was like homework. And there were some resources in there, but I still felt like it wasn't completely tailored to me. It
Mm-hmm.
was just like, here you go, take the care package, check out, the pamphlets, and let me know if you have any questions. So I
Yeah.
did find it very helpful to be able to have people around me to ask questions. And I always told myself I wasn't going to rely on Google.
Dr. Wildgoose, do you find that that's something that you often encounter when patients come, either like they come to you initially, or if they come to you after having seen another doctor, like the idea of like kind of being overwhelmed by information?
Oh yeah, totally. I think I think yeah, the major thing that I see in 100% of my patients, and I say it's major because it's one of the standout things that occurs in every single person's cancer journey, is the overwhelm and the psychological distress that occurs immediately after getting a diagnosis, particularly after that colonoscopy, before they have a treatment plan. And it's usually a couple of weeks before they're able to get in to see the oncologist, or if it's the surgeon or the medical oncologist, to really get a treatment plan. And it's those 2 weeks that patients really have a lot of anxiety. They have a lot of guilt. And it goes back to actually, the guilt goes back to your original question, was sort of like, what is that? Like, what happened prior to and Melissa touched on it, that she was fortunate to get a colonoscopy. But we know, and this being March, Awareness Month, and I always take every opportunity to say that in younger patients, they don't expect this diagnosis. So there's so much guilt thinking back, saying, what did I do wrong? I should have acknowledged my rectal bleeding sooner, but I thought it was just hemorrhoids. I should have noticed that I was having changes in my bowel habits, but I thought it was just stress related to work. And that's the reality of younger patients in their 20s, 30s, and 40s. That's a whole reason we started this clinic because, for example, Melissa, she's in her 20s or 30s and has children. So of course you're going to attribute your symptoms, if you have bleeding, to hemorrhoids, or changes in bowel habits to having kids. For example, a man who's sitting at his computer all day long because he's in the middle of a career and he's totally stressed out. Like, you're going to attribute those symptoms again to sitting all day, to being stressed out at work, to having a family to take care of. There's so many different things that you could attribute your symptoms to that patients don't, the public doesn't, and they don't think colorectal
And
cancer.
and do you find that this is also something that doctors tend to think or feel when patients
Yeah.
come presenting these symptoms?
Yeah. So like I would say 9 times out of 10, it's I know Melissa got a colonoscopy, I think fairly soon, but I would say 9 times out of 10, what happens is patients themselves delay going to the family doctor. And then, having previously worked in primary care, our system is very overwhelmed. So as we're all aware, it's a 15-minute appointment. It might take you 2 weeks to get that appointment. And by that point, and then you have that hour sitting in the waiting room, waiting for that 15-minute appointment. And after that 2 weeks and 1 hour, then you have 15 things on your list to ask the doctor about, because you may not see them again for who knows how long, right? Because it's hard to get in. So generally what would happen, or what happens, is, okay, I'm going to make sure I get my refill of my medication, talk about the things that are really pertinent. And then it's, 14 minutes and 30 seconds into the appointment, and you can see your doctor sort of walking out the door, and the patient says, oh, but I've had these changes in my bowel habits. I've noticed, some more diarrhea than normal, like looser stools. And of course, family doctors not being, aware also there's this increasing incidence in younger patients. They say, okay, well, how long has it been going on for? Well, maybe it's just, irritable bowel, maybe it's anxiety or stress, or maybe it's the hemorrhoids. And so if you keep having it, come back in and I'll see you again. And so there's just so many reasons why there can be these delays in diagnosis. And we see significant differences in the time it takes from a young person under the age of 50 compared to somebody over the age of 50 to have symptom onset to diagnosis, as well as symptom onset to treatment. And there's significant differences for this reason. We need to raise awareness. We need the public to look at their poop. And if they have symptoms of colorectal cancer, to go in and ask for colonoscopy, number one. And number two, we need to encourage family doctors that if they see symptoms of colorectal cancer in patients under the age of 50, to do a colonoscopy, because this could be colon cancer or rectal cancer.
Yes. Melissa, did you know the symptoms that you were having were related to colon cancer?
Not at all. And to be honest, Carl, I remember maybe even the night before my colonoscopy, I started looking up like IBS, Crohn's, colitis, and none of the symptoms really seemed to align with what I was going through. But again, relating the blood in my stool to hemorrhoids, and hemorrhoids that maybe I didn't even see, because then I learned you could have hemorrhoids you don't even see. I would have never, ever thought this was cancer. And I don't have a family history of it. I didn't know anyone at the time with colorectal cancer. So it was very new to me.
Yeah. Also, before I ask my kind of next question, I just want to remind that everybody watching, that if you do have questions for us, there's a question and answer Q&A box in the bottom there. It's kind of got a question mark on it and should say Q&A. If you do have questions for Dr. Wildgoose or for Melissa, you can put them there. We'll answer them at the end of the talk. Although that did totally throw me off my train of thought. Well, how I think actually that what I was going to say was that there's this element of like we don't want to talk about our poop, which as a culture, I think Canadians tend to be very private people. Um, but I think also there's kind of just a fear of like I know a lot of people are afraid of getting cancer and of bad things happening to them, which makes sense. And that leads to not talking about it. But yeah, like what you had said earlier, Melissa, of like there's other people, there's community. Talking about it is so important. How did you kind of seek out good information once you were looking for it?
I think what helped me was asking several people that I knew and trusted, and people that maybe had similar values to me. Um, so, as an example, as a young mom with three children, I'm trying to raise them in a healthy lifestyle. And I know we're very exposed to a lot of toxins in the environment. Even the foods we eat now, I'm looking at things and, thinking back and talking to my parents. Yeah, we used to eat these things when we were kids, but they weren't made the same way that they're made now. And that's been a focus for me as well. So I've even connected with people that are in that mindset where they're trying to eliminate some toxins in their lifestyle. And I've been finding that things are reassuring. So, even when I do connect with other colorectal patients, if we have similar experiences or we're both asking similar questions, it's just that validation to me that I'm on the right track.
Hmm. And Dr. Wildgoose, what's your sort of like advice or a strategy that you think is effective for patients who do need information to go get reliable, accurate information about their situations?
Hmm. It's a good question. So, what I would say, going back to what Melissa said earlier, is that it is a very personal journey, and I consider, and we should all consider, this diagnosis as a traumatic experience in someone's life. And so, it's what we're talking about is suffering ultimately. And while suffering is universal, it's also very personal. So, one of the things that I do, which I didn't mention at my clinic, is I provide very personalized and individualized care. So, I get to know my patients very well and I work one-on-one with them. And so, the resources I provide to patients are really person dependent. Um, and unfortunately, it's like everything else in our healthcare system. It's very siloed. So it's part of my training. I think as a family doctor is just to search out quality resources and supports. And so that's what I've done for a lot of my patients. And it does exist. There are supports and resources out there, but it's very siloed. And so it does take effort. And I would say that the number one thing that patients, it's interesting, the number one thing that I find that young patients say is the most helpful thing that I do is helping to navigate care. And that's because, again, most of the time, it's their first time being exposed to the healthcare system. We're talking about young, healthy people here, right? And they have no idea, what does it mean to have a CT scan? Even that, something as simple as that, just getting that initial upfront imaging can be very overwhelming and nerve-wracking. So is number one, helping to navigate care, and number two, providing resources and supports. And so patients, again, like Melissa, like you have a life. That's one of the issues with these young adult patients, right? Like when you're in your 70s and 80s, you're retired, presumably. Like maybe you have a bit more time, maybe you don't. That's an assumption. But essentially, they're starting their careers, they're starting new relationships. They may or may not have children. They may still be in school. And then throw a diagnosis of cancer onto all that. They can't just stop what they're doing all of a sudden. And so to find those resources and supports that are number one, the most helpful for them personally, and then is a very difficult thing. So yeah, it's not simple, it's not straightforward. They exist, but that's part of what I do at my clinic. And I do find that people who are younger, like Melissa, are very empowered and are really good at self-advocacy, and so do tend to do a lot of work themselves to reach out and find supports. We're lucky that we have CCC, obviously, as a huge support to my patients and all young adult patients, but it can be very challenging and very overwhelming.
Yeah, I'd love to talk a little bit more about advocacy in just a moment. And I know we were going to save all the questions for the end, but I see one here that is asking, and I think this is worth mentioning while we're in this space, which is from Mary. What do you think about those at-home tests for poop tests? So FITs. Do they work, or should people insist on getting a colonoscopy rather than the intermediary tests? And this is something that I think is a great question because I have had a colonoscopy. I was very lucky when I had an issue with blood in my stool. Doctors took it super seriously, sent me immediately for a colonoscopy. I was young, could have been anything. It wasn't cancer, but I was glad that it happened. But colonoscopies suck. You lose a day at least. Um, and it's I can see why it'd be difficult to schedule in a procedure like that. So can you speak a little bit to the efficacy of FIT tests?
Well, I just want to be very clear that if you have signs or symptoms of colorectal cancer under the age of 50, you should be going for a colonoscopy. And yes, Carl, they suck. But every single young patient and older patient who's been diagnosed with colorectal cancer that I've spoken to, which is a lot, has said it's nothing compared to having the diagnosis. They would go through a million colonoscopies. So that is the whole point. And that's when we talk about lowering a screening age, right? Like, and they've done that in the States. It's now 45. And it's interesting because, when I used to work in primary care, if the cutoff is 50 for screening, if someone came to me and 48 and said, I don't know, like I'm having symptoms, I would send them for colonoscopy. You just send anybody for colonoscopy, right? Like that should be the test that you do if someone has symptoms of colorectal cancer. If we lower it to 45, that takes everything out of it, right? Like we don't have to think. That population between the age of 45 and 50 is just automatically going to get screened. And then you think, okay, well, that person's 40, 41, 42, 43. They're getting up there. And the family doctor then might think, okay, you know what? I got to take this person seriously because we're now screening at the age of 45, not 50. So, um, yeah, it's a good question, but the at-home test is really just a screening test. It's not a test that I would recommend or anybody recommends if you're having symptoms of colorectal cancer.
Right. So if I understand correctly, your opinion of it is like it's if you're exhibiting symptoms, you need a colonoscopy, and the FIT is okay for sort of, well, like you said, screening. Yeah, which is, one of the things that we're, I think, really advocating is screening, and FIT is, would you say that is accurate to uh, say that like it is useful or it is like a good thing for people to do
It's the
broadly?
best we have. Yeah, it's the best we have for
Great.
screening.
Yeah. So Melissa, I wanted.
Screening,
Oh,
sorry,
sorry. Go
Carl,
ahead,
not
Melissa.
to
Please,
cut you
please.
off,
Yeah.
but for screening, but we should also remind everyone that screening and diagnosing are two different things. And that's something that I learned about on this journey because you are going to get screened because you don't have symptoms necessarily. So that's part of the screening process. But as soon as you have symptoms and you go, now you're being diagnosed with something, whether it is any gastro concerns. That's just something that I wasn't really aware of prior to this. So I just want people to understand that you're not pushing for the colonoscopy necessarily because you have symptoms. Absolutely do that. But I'm trying to advocate, especially for women that may have that bleeding, just go get checked. And even if you don't have bleeding, we could have polyps that we don't even know about, and you find out about them through a colonoscopy. So it's really good to get that done. And I know the age is 50, but I'm telling everybody in my age demographic.
Yeah. Well, and actually just that level of like I'm telling people they should go look for the stuff that they need. The uh what we had talked about earlier of like advocacy of like kind of learning how to because I mean in our sort of pre-interview we talked about how the medical system is really great at treating cancer, but not so great at teaching people how to navigate the medical system.
Yes.
Um, so I'm curious, Melissa, how you learned to sort of speak for yourself and advocate for yourself over the course of your experience.
Sure. So I know we had talked about how there's no playbook. So, in that pile of papers that I left my oncology appointment with, that was already months into my diagnosis. And it's almost like I wish I had received the diagnosis and here are my next steps. And, these are some of the support groups I could reach out to. And if I had specific questions, here's who I could call. Because you do get lost on the internet. And that's why I said I don't want to be Googling things. Um, and really, I think just speaking with other people was the only way I could find out about resources and finding out about the CCC because I didn't know. And I don't think anybody would unless they're affected by it or they've heard about it. And I must say, along this journey, one of my goals is to advocate for that as well and remind people that are going through anything that we're allowed to ask questions. I also learned you're allowed to ask for a different doctor if it's necessary. They're your primary caregiver, and it's important that you get along, you see eye to eye, that you just jive with that person. And I think that makes our care even better, and offers a better experience in such a tough time. And I was going to use an S word in there, but I thought I'd censor myself.
Yeah, we don't have the live
Yeah.
beeper. Yeah,
Just because we're talking about poop.
we can say poop. Were you
Yeah,
pooping? Were you pooping me? Um, well, so the idea of like kind of building a team is something that we did talk about as well. And I'm curious about what that was like for you in terms of navigating the diagnosis, navigating treatment, and then also trying to assemble the right group of people who will work with you.
sure. So, um, having gone through what I've gone through, I also think back and I question sometimes. I had no idea that there was different types of surgeons. I was referred to a surgeon immediately when I got my diagnosis. The specialist that did my colonoscopy said, I spoke to a highly recommended surgeon. His office is going to call you tomorrow. And I was like, okay, this is great. We're tackling this. It's a big rush. Let's get this done. But, as time passed, I learned a little bit more about this surgeon, and he wasn't necessarily a surgeon that specialized in colorectal cancer. And I hadn't even known about talking to an oncologist at the time. I was under the care of the surgeon, and he said to me after the surgery he was going to recommend I go for adjuvant therapy and he would refer me to an oncologist. And in hindsight, I wish I had the oncologist on my team from the very beginning. Someone that was going to go through my scans, someone that could have explained this type of cancer to me. I didn't have that, and I don't think everyone's in that same position. And to Dr. Wildgoose's point about having this center, I feel like it's so beneficial that, if we could streamline this, if not in Canada, even by province, to say it doesn't matter that you live an hour and a half away from this center. If it's a really good resource for you because of your situation, Melissa, this is recommended for you to go check out. And then you decide. And I feel like if I had that tiny bit of information, I could have had a better way of navigating. I also feel like I navigated because of my personality and my interest in this. And, some people think or say to me, I don't know how you do this. And I feel like you just gain that strength and determination when you hear those words that you have cancer. It literally changes your life. And you just reach this point of figuring it out.
Yeah, the
Um,
highest possible stakes.
yes. And you know what, Carl? I think a lot of younger people now, and Dr. Wildgoose, I don't know if you notice this at your clinic, but I feel like we ask big questions today that may not have been asked, 10 years ago to their doctors. I feel like amongst my circle, we have some questions that, you some may feel afraid to ask a doctor. And I don't even mean like just challenging them, but just inquiring. Because I think sometimes we forget that, the few generations before us were very much in agreement with here's what the doctor says you're going to do, and you're going to go and do it. And I've been trying to follow that, but also trying to be very inquisitive along the way.
Yeah, to be informed. I mean, it's a principle of informed consent, right? Dr. Wildgoose, I'm curious about like what it means from like the physician perspective to like try to both like what Melissa had said about if somebody presents with these symptoms, let's send them to the center where they know where it's a good team where it all works together. Like how do you um educate physicians about early age onset stuff about what's happening this way? I am curious about like what that looks like. Because we do a lot of work at CCC about working with patients and educating, educating the public. What kind of work like that happens on the other side?
Yeah, we do a lot of work. I think we're fortunate to have partners such as yourself who say, hey, you might be eligible to go to this clinic. And we're really fortunate for that. And we do a lot of, like I say, I do a lot of advocacy. And the surgeon that I work with, the surgical oncologist, he also does a lot to try to raise awareness. The reality is that even if, we were able to get everybody, there's barriers to that, right? So we can't see every person because there's also, however number 20 or 30 other surgeons in the city that are going to need to operate, right? That's what they do. So it's unfortunate, but that's just the way it is. And we would never get through that list, right? If every young patient came to us, I don't know if that would be possible. It's just basically a healthcare system issue, right? It's how our healthcare system is set up right now. So, but I mean, we're trying, we do have patients that come from hours away to our clinic. A lot of what I provide is virtual care. So, on evenings and on weekends, so that patients don't have to leave their home to see me, that they can see me after hours after they've taken care of their children or they've gone to work. So that virtual care piece is really pivotal because it allows there to be more outreach. I'm also working with a lot of other doctors to try to establish more of these clinics. And we do need more of these clinics. Like I would love to be the center in Ontario, but I think just the way our healthcare system is set up, it's not feasible. And the aim and the dream would be encouraging others to open more young adult colorectal cancer clinics because, Melissa said it perfectly. Like I didn't even know I had an oncologist. Like, what do these terms even mean? And yeah, you're just thrown right in, and you're supposed to just sort of follow along, but it's a lot more complicated than that when you're a younger patient. And you deserve more time, and you deserve someone to sit down with you and say, okay, this is what this means, and I can help walk you through this, and this is what to expect. And I think that's a huge thing that I see also is managing expectations up front with a lot of younger patients, sort of what they can expect down the line so that they can plan because they have children, they have spouses, they have parents. A lot of younger patients are also the caregiver to their parents. Um, there's just so many factors that come into play that it's really important that patients, like Melissa uses the term playbook, but they sort of know what these terms mean. They know what to expect. They know sort of what the journey might look like so they can plan their time off from work, for example, for their care. So yeah, I do a lot of that work with patients individually, but it takes someone like myself to start these programs in other cancer centers, and they're slowly occurring. I hope, but it just takes a long time. It's just like anything in medicine, right? It takes 10 years for actual change to occur, right? So I think it's happening, but it's slow.
Yeah. Well, and I think something that kind of responding to a question that was asked, saying that like I wish we could develop a campaign to educate everybody from as young as school age to look at their poop. And I feel like even taking that a bit more broadly of like for younger people especially, if they are having a sort of like major medical moment, it's probably the first of this kind in their life, you know? It's like an older person might have more experience with how to navigate the medical system. So, like a younger person who is also now trying to deal with a cancer diagnosis, they're also learning how to navigate all of these doctors and everything that happens, you know? Do you see a place for like you say, it's you know a systemic change that's happening for this sort of more integrated approach. Um, how, what's your sort of ideal way of like making sure everybody knows what they need to know about colorectal cancer? Small question.
What's the ideal way? I mean, it's like the ideal way is just because again, system change takes a lot longer. Um, and yeah, establishing these clinics are going to take a lot longer. And I know that because I've done it. There's a lot of roadblocks and, government support issues. And so, the number one thing that we can do is simply educate the public and educate healthcare providers. It's exactly what we're doing right now. And it's unfortunate, you know, I was in a talk once and the patient said to me, I shouldn't have to be doing this though, right? Like I shouldn't have to be advocating for myself while I'm undergoing chemo or radiation or, post-op and having nausea and vomiting. It's true. You shouldn't have to. But unfortunately, that's the case of our healthcare system right now. And so it takes healthcare providers and it takes people like Melissa and groups such as yours and organizations such as yours to actually say, listen, this is an issue. And it's still slow. Like to the person's question, yeah, but there's no one way of doing this because everyone accesses different sources of media too, right? And the younger population between the ages of 20 and 50, for example, it's social media. So, but everything is just so quick to change. And then, the sources of information are so, I don't know what the term is, but it's very difficult it's not like the olden days where you had a newspaper, right? And everybody read it. So I wish that would be the easy way if you asked for the easy way.
Yeah. Is banning social media, returning to legacy media.
Force everyone to read one thing.
Yeah. But then we wouldn't be having Zoom, so I don't know.
True. Wouldn't be here.
Um, yeah, I'm just looking at my sort of list of topics here. Because I think it'll be time to turn it over to the questions from the audience in just a moment. But maybe before we do that, I'll ask you, Melissa, first. Is there anything that you think is really important that people understand about being a younger colorectal cancer patient survivor?
Oh, that's a loaded question, Carl. um, One of the big um, mantras, I guess someone had called it, for me was coming up with something that I share with my close friends and family when I send an update about my health. And I always try to end my messages with enjoy all of the things going right. I think we are so overwhelmed today with negativity that, no matter what diagnosis you have or what ailments you have, we should really focus on being positive, being kind. We try to teach our children to be kind. So, it's become popular to say, be kind to yourself. Um, be patient with yourself. I strongly advise anyone going through any type of trauma or major stress in their life to have a therapist. I found that extremely helpful. And then, as I mentioned before, asking the big questions, not to be afraid of them, and enjoy who you're working with. You don't want to look back and have so many regrets. You want to try to enjoy this as much as you can. I mean, enjoy is not the right word, but I think everybody understands what I mean by that. And then definitely go get your colonoscopy. um, and really, we touched upon this in the beginning of this chat. In hindsight, like Dr. Wildgoose said, I would go for a colonoscopy every day if I didn't have to go through what I'm going through. So my big message to every young person is just go get checked, plan for the day off, watch TV, binge whatever you want to splurge on before you have to um, fast and clear out. But in the grand scheme of it, it's so minor.
Yeah. Thank you. And Dr. Wildgoose, how about you? Is there anything that you think is if you had like one last really important thought that you wanted people to understand? Um,
Yeah, I want to validate Melissa. The psychological impact of having a colorectal cancer diagnosis at a young age is huge. And there's so many things that impact mental health, from the smallest thing, which, is just sitting in a waiting room, causing anxiety, to, the overall diagnosis itself. There's just so many factors. And so, um, when I counsel patients, when I first meet them, it's, we're going to take care of your cancer. We're generally really good at doing that. We've got the chemo, we've got the radiation, we've got the surgery. But the most important thing that patients can do throughout that journey is maintain, to the best of their ability, their physical and their mental health. And mental health is a huge component of it. So whether it's, therapy or medication, and then all the adjuncts like Melissa spoke about, like practicing gratitude or mindfulness meditation, all of those things are important. It's whatever gets you through. And unfortunately, in younger patients, a 75% are a stage 3 or stage 4 in diagnosis. And it's more common to have a rectal cancer than a colon cancer, which means longer treatment with more side effects, and therefore, longer term consequences. So it's not a sprint, it's a marathon. And it's really important that every patient, not just younger patient, looks after themselves. And so I do really encourage, I would love to see every person out there, because this is, I'm motivated every day by people like Melissa. That's why I do what I do. Um, Unfortunately, we aren't seeing everybody, and so people who are not coming to my clinic, I really encourage you to reach out, whether it's to your family doctor, a social worker, family, friends. Look at Melissa as someone who's done this and has been able to make a difference in her care and in her life, because she was able to self-advocate. Reach out to me. My email address is on the website, and I'm happy to help and provide support as best I'm able, of course. But it's really important that you find resources and supports to help you maintain your physical and your mental health as you go through your colorectal cancer journey as a young person.
yeah. Thank you. Um, let's answer some questions. So I don't know if you can see the questions. I might have to feed you the questions. We'll find out together. But there's one right here that I see that I can answer for you, which is from an anonymous attendee. Thank you, anonymous. Are there resources that CCC can provide? Yes, there are. Go to colorectalcancercanada.com. We provide individual counseling, group counseling, a sort of textbook that you can bring with you that records all your notes, a cancer journal, all sorts of really useful resources that maybe Melissa can speak to. Did you enjoy? But you said that you found CCC helpful to you. Was there any particular resource that you think people could be directed to that you made use of?
There was, and I don't remember how to get to it, but I remember, especially following CCC on social media, there are facts and myths that CCC shares a lot. And I really like that because I think it helps change that perspective that people have. Um, and then support groups. So you don't necessarily have to be a patient in order to participate. There's also support groups for caregivers, and we can't forget about them.
Very true.
I'd like to actually point out that CCC does have a Never Too Young toolkit that I helped to create, which I was honored to be a part of, but it's actually very helpful and it has fill in the blanks for you to actually write, who your medical oncologist is or who your surgical oncologist is. And I think it's actually a great resource. I provide it to every patient that I see.
Thank you both. Your checks are in the mail. Um, so here's a question. Any thoughts about what we can do to change policy? This question asker doesn't say towards what, but we can assume towards more access and more information.
Advocacy. Doing what we're doing, like groups like CCC does a lot of it. There's other organizations. Do you know what it is? It's social pressure. It has to come from people like Melissa. It has to come from the public. It has to come from patients. Um, and I think we're almost there. When you talk about change, I think if you're talking about changing policy with respect to lowering the screening age, there's a lot of groups working at provincial and national levels. Um, I'm hoping that we're almost there in terms of lowering it to 45, but changing policy is extremely difficult. And it's really just engaging stakeholders at multiple levels and getting everybody on the same team. And again, that's talking again about silos, right? We all work in silos, unfortunately. So that's also part of what I do is I try to bring these groups together and to function as one, because as one voice, we're going to be heard a lot more than all these smaller voices. But social media also has been helping, I think, significantly. And there's people like famous people, I think, who have now started, posting, and that's bringing a lot of awareness as well. And so, there's all these tools that I think are helping to, raise awareness and advocate. And I'm hoping that's ultimately what changes policy, but it's just social pressure, I think.
Yeah. Um, Thank you. I have another question from Anonymous. Anonymous is asking a lot of questions. But this is a question for you, Melissa. Thank you for being so open. Could you say more about scan anxiety?
Sure. So, my definition of it, I think it's very similar, is the anxiety that you have while you're waiting for your scan and also waiting for your results. So, one thing that I've learned from other patients is back to my comment in the beginning about we're all on our own journeys. Everyone has a different schedule of scans. So some people may be going for a scan every 3 months, some every six, some every year, and so forth. The anxiety comes where sometimes you literally feel like you're living scan to scan. Okay, nothing showed up on this scan. I have another one in 3 months. Is something going to show up again? And then if something does show up, then there's another scan and it's like, okay, how has it changed? Has it gotten bigger, smaller? Do you know? So I think that's kind of like the long version of what scan anxiety is, at least to me. But I think a lot of people feel that. And again, it's not necessarily just because we're cancer patients, but you can have that awaiting any test result.
Hmm. Yeah, and actually, this is such a sort of growing specific phenomenon that we released a Tush Talk about this. So to the anonymous question asker there, you can go to our YouTube channel, Colorectal Cancer Canada, and there is a Tush Talk about scan anxiety specifically. So you might find that a good resource.
Just
I have a
if I
question.
can
Sorry,
say
go ahead, Doc.
just to validate Melissa, I actually share in a lot of presentations that I do. There's this chart that actually graphs what anxiety looks like along the cancer care journey. And it's actually very well known in the cancer literature that anxiety peaks. It goes like this up and down, up and down, up and down. And it peaks with scans. It peaks with clinic appointments. It peaks with treatment. And so the anxiety is real. And I tell every patient that. That's again managing expectations up front. Like this anxiety is real. And you're going to have it every time you go into the hospital. And sometimes you may not know why you're having the anxiety, but that's just part of what's happening with the cancer journey. And so it is to be expected and anticipated. And it's unfortunate, but it's well documented.
Yeah. I also just appreciate to validate you, how you take the time specifically to validate Melissa's experience. I feel like it's a clinic on good medical practice. Um, so here's a question for you about maybe less good medical practice. So this is from Tyler. Tyler's husband is otherwise fit and healthy, but was recently diagnosed with colon cancer at 47. He started seeing his doctor as soon as symptoms began, was told that he was too young, and the doctor would not send him for a colonoscopy. Eventually, his symptoms progressed, went to the ER, got a colonoscopy appointment 8 weeks later. Do you know of other ways to access a colonoscopy if having symptoms and your doctor will not take action?
Yeah, I'm so sorry to hear this. I've heard this story before. You're not the only person, unfortunately. Um, I can say some doctors are really great. They instantly send for colonoscopy. That doesn't exist. There's no rule that someone can't be sent for a colonoscopy. Doesn't exist. Um, you know, and again, it shouldn't be in your court to, and there's a power struggle there, right? Like, you're the patient and kind of like what Melissa said, like, it's hard to sometimes feel like you can speak up. You've already said what you've had to say, and they say, no, you're too young. And so how do you then voice, well, can I just have one, please? Like, it's a hard conversation to have, a really hard conversation to have. How do you get one otherwise? You go to a walk-in clinic, you go to the emergency department. The unfortunate thing is that the emergency departments are, so backed up. But it's what the best that we have, unfortunately. Um, take what you could do is, go back to that physician and reach out to groups like Colorectal Cancer Canada and take with you, a document that shows that it's real in younger patients and that I need a colonoscopy. So reaching out to support groups to provide that literature to that doctor. I myself have had to do that. Actually, I've had to email the physicians and say, this is the case, and can you please order X, Y, and Z? But you're not alone.
Yeah. And to kind of bring it all full circle, because I think we are coming up on time. Just to connect what you just said of you're not alone to Melissa, what you had said at the very beginning about something that you learned is like the connection, the community, are so important. That's kind of what we're all doing here. Everybody in the questions, asking the questions there, you two, us at Colorectal Cancer Canada, we're trying to make it so that nobody has to be alone in this, nobody is alone, and that people know that they can get help. So I maybe we'll close with that, and just sort of reinforce for the folks listening that if you do need help, if you do if you had a question that we didn't get to, you can reach out to us. Our website is colorectalcancercanada.com. You can email us at info or support at colorectalcancercanada.com. And we have specialists in support, in connecting you with care and connecting you with clinical trials, all sorts of really useful things that are there for you. So I just want to thank you very much, Dr. Wildgoose, Melissa, for joining us for this, our first ever live Tush Talk. We're blazing a trail. Zoom has been around in public life for 5 years, but we have made it happen. And yeah, I'm gonna. Oh, we are at 8. So I was gonna say any closing words, but any brief closing words from either of you?
Besides, go get your colonoscopy. That's all I've got.
And look at your poop.
And
Yes.
look at your poop. Thank both of you so much. Before everybody leaves, I do just want to mention one last thing, which is that by being here, you are helping to support us in the same way that we are trying to support you, and becoming an informed advocate for your health. You're helping to further our mission to decrease mortality for colorectal cancer in all across Canada. And if you want to support our work further, maybe financially, maybe by volunteering. I'm going to put up a slide right now that's like a thanks for watching slide, but there's also the contact information of our director of development, Natalie Smith, and you can reach out to her as well to see how to help us help you. Thank you all very much. Have a wonderful evening.